I just open up for questions and say thanks for coming. And I hope you're getting from our team today, tools and ideas and things like that about how we can work better together. But I'm happy to answer some questions. Yeah.
Just wanted to, it's exciting, I think, your focus on cost, quality, and access with a healthy imagination. 15% is an ambitious goal. And it's coming at a time when we're anticipating in our healthcare field a surge of activity in terms of more insured folks through the healthcare reform. I enjoyed reading about your concept of reverse innovation and how you've been using that, particularly with technology. Are there lessons to be learned in the developing countries where they've had to deal with population growth much more aggressive than we've seen, about the processes of managing surge and handling increased capacity for access management?
It's a great question. It was quite interesting. So we had this advisory board this morning, and we did the same thing in energy maybe 5 years ago, and I learned quite a lot. I mean, what I found was that we had NGOs, we had people in government, we had venture capitalists, stuff like that. I actually found over the last 5 years I became much smarter about energy by having this advisory council and having it be so diverse. I was very there would actually be meetings I looked forward to going to, which I can't say that about many of my meetings these days. And so Newt Gingrich is one of the guys on the panel, right? He just happens to be one of the smartest guys that ever, politics aside, right? He is such a brilliant guy, Jim. And, one of the things that he suggests to us, I think is actually quite good, is that we try to congregate, 25 experiments that we either run with you or we bring from other countries and say, look, here is a real best practice on this. This place, and I can just think of one that'll turn your stomach, but I'll mention it just because I think it makes your point, right? And I think Mark's probably been there. I don't know if Omar's down here, but if you go to these big thoracic surgery places in India, right, one physician will do 20 open heart surgeries in a day. In a day, right? The patients are up walking around like 2 hours after their surgery. It costs $2,000. Now you sit there and say, how many lawyers, how many lawyers do I have to hire? What would I possibly do? But that exists. I've seen it. I've been there. It is stunning. And because I've studied healthcare, I sit there and say, who's the heart doctor you want to go to is the one that's done the most surgeries? So I say to my wife, look, if I'm fly me to Delhi, right? If you really, if I'm looking a little pale, you think I might last a day or so? This is the guy that's done. So I don't know how good those are for all of you. In other words, some of these things just can't be done in the system we're in today. But even inside the U.S., if there's ways to share these experiments, I actually think that's something GE can do in a system-wide basis, is go after what Virtue has done, what Kaiser's doing, what exists in rural clinics and things like that, because a lot of this is going to be best practice sharing, and some of the lowest cost systems are outside the United States. I mean, really, if I just put on my citizen hat, right, and not my CEO of GE hat, even if you go to Western Europe, guys are pumping through 30, 40 MR patients a day in every MR scanner. They're running these MR centers 24 hours a day. They're doing good standards of care. They're doing high quality. They've got good radiologists. They've got good diagnostics. And they're just working the equipment 24 hours a day. And I think we're going to have to be more open to, and our business has to be very open to supporting you in activities that are going to help lead you to lower cost. And it's just systems. We can't base our business based on systems inefficiency. We've got to base our business based on high quality, low cost standards of care.